Hi everyone, it's your girlfriend Caroline. It's always a privilege to come and talk to you concerning nursing. I'm so excited that some people called me that they've got into nursing, they were inspired by my video and they're not into nursing. And I just thought, okay, yes, you're not into nursing, you might need help with essay writing. So today I made a topic that would help you in navigating around your essay writing. So today's topic is nursing essay writing with a sample topic. I'll tell you about my sample topic in a few minutes. In nursing, before I talk about my sample topic, I want to talk to you about how you can write your essay writing. In nursing, they expect you to have a way of writing. You have to start with an introduction, you have your body, then you have your conclusion, and at the end, you have your reference list. So what's going to be on your introduction? Your introduction is what you will write in your body. Just like you saying, okay, I'm going to do this, I'm going to do that, I'm going to do that, I'm going to do that. And you do that. Plus, in your introduction, they expect you to make definition of all that you're going to talk about in the body. Do not make a mistake while writing an essay to start defining your terms in your body. No, that is very wrong. You should define your terms, all the terms, well, not all, most of the terms that, major terms that are in your questions, you define them in in your introduction and not your body. I will show you an example in my next slide. But in your body is where you start your discussions. It's just like you go into a restaurant and you order um, a starter, then you eat a main meal, and then you have a dessert at the end. That is exactly what it is in essay writing. So you have your introduction, you have your body, and you have your conclusion. So what is your body? In your body, you discuss what you initiated in your introduction. And your introduction is going to be a navigation of, it's going to dissect your topic into several chunks. You'll see my next example, the example in my next slide. But your conclusion, you are going to summarize all that you've written in your body. And in your reference, you have your academic reference list and any book that you have used, like academic journals or books. So this is an example that I have that is very common in nursing assignment. So in mental health, it might go like meeting the needs of mental health patients for a positive health outcome or a positive outcome. In mental health, it might not necessarily be health, might be holistic holistic outcome. But that is why we always leave it at positive outcome. In adult nursing, they might focus on health. Is the blood pressure okay? Is the pill score okay? Is the new score okay? Yeah, this patient can be discharged, this patient is eating, is drinking, the health is fine. But also even in adult and children nursing, they're also bringing into consideration psychosocial needs. Like on my ward, we always make sure that before we discharge the patient, we make sure that they are going to be in a safe abode, they are safe, we look at their psychosocial reasons. So also in health, they've moved in children and adults, they've moved away from biological model and they've all moved into psychosocial model. Um, where we look at biopsychosocial, where we look at the bio, we look at the psycho, and we look at the social before we can discharge a patient. So, and also in learning disability, you look at the holistic, the health, everything. So, the four compartments of nursing, you will be looking at an holistic view, the holistic view in your assignment. So, So the topic that I brought about today, meeting the needs of service user for a positive outcome. So if you are a mental health nurse, student nurse, you insert mental health service user, then disability, adults and children nursing. And then you would have to define what it is to have mental health. You define what it is to have learning disability. For learning disability, you have to also talk about the spectrum of the learning disability. from mild to profound learning disability. You have to talk about that. And also you have to define positive health outcome. What does it mean to have a positive health outcome? For patients with learning disability, what is a positive health outcome? What is it? For learning disability, what is it? If this person is discharged, is there a reasonable adjustment put in place for my patient before they are discharged? For mental health, does this person have capacity? Have we done the capacity assessment? Has the capacity test been done? Do we have alternative? And so the positive health outcome is always opposite of what they came in with. Like if somebody came to the hospital with headache, a severe headache, is this person going home without this headache? Is this person going home with even if the blood pressure is not still low, they came in with high blood pressure, but is there a way to manage this high blood pressure? Maybe they've given some medication to lower it and manage it. So that's a positive health outcome. And also introduction, you need to talk about, but remember in introduction, you are not analyzing, you are just defining. Your analysis goes to, and your discussion goes to your body. You are only defining. That is why you can just use a textbook. You're only defining what a positive health outcome is, what learning disability means. And also in your introduction, they expect you to talk about your demographic details of your client group. Like for mental health, you talk about the death rates of people with mental health, why they die early compared to people without mental health, why they commit suicide, where their suicide rate is very high. Why? You look at this the mortality rates. And also for adults and children, you look at for all fields, you should also look at the morbidity rate. The morbidity rate is the illness rate. How often do children have asthma in winter? Why do they come, or during winter period, they come in a lot with DIB? Why? This is what statistics shows. So all these you talk about. So you have to bring in statistics. So all these are your introduction, and for you to have a good mark, usually introduction, some schools give introduction 10 marks. I'm sorry, 10% of the mark. So if you have a good introduction, you've secured yourself a 10%. And some you also give 10% to conclusion. You have a good conclusion, another 10%. So you already have 20%. And if your pass mark is 40 to pass through, just make your body good and you have minimum 20, you see that you pass. But for us on this group, we are not aiming for 40, we are aiming for distinction. So come with me. So now let's go to the body. So the body is where the juicy meal is. You know, when you go to your restaurant now, yes, the juicy meals arrive. You have to make it very juicy for your lecturer to read through when they're so very interesting. But essay, I should say. But the introduction would show that the body is going to be very interesting. So now we are at the body. So in the body, you would need academic journal articles for your client group. So in this, you'll be looking at why is it important for nurses to meet the needs of your patient. Here you'll be talking about the NMC, the code. The code, I think the latest one in 2018. You talk about the duty of care that we have. You talk about the 6 C's that we have, that we need to give to our patient. And you also talk about, you also identify legal framework, such as for Learning Disability Equality Act, Mental Health, Mental Capacity Act, Dignity and Respect for people, for adults, even across all fields. And for children, Gillick's competency for the young adult. So you have to mention this so that your lecturer must see this aspect in your body. And if you are if you are year 1 or year 2, I'm not quite sure where, you have to start to become analytical. So to become analytical, you need to bring ethical dilemmas in. What are the ethical that, yes, I want to help this patient to have a positive outcome, but what are the ethical dilemma I'm facing? What am I facing? This patient, like a patient, like a Jehovah Witness that come in and said, no, I have capacity, but I do not want to take this blood. But as a nurse, because you would ask questions, you know if this patient have capacity. For mental health, they usually go use this mental health assessment tool. They ask some questions to know if this person's have capacity, and if the person has capacity, so they'll use the five inside the five principles. The one that says, "I have the right to refuse care." They have the right. They are informed. They have the right. It's under the five principles of mental health. They have the right to refuse care. But then you do not just leave. You need to protect your pin. You need to protect yourself. So what will you do? You give them enough information, inform them, inform consent. You give them a lot of leaflets, you sit down with them. I know you want to make this decision, but these are the risks of if you do not take this blood, and if you take this blood, this is the possible outcome that you would have. And you signpost them to wherever they could get more help. And you might be surprised, some of them might come back and say, okay, I'll take the blood. So, but you do not just say, oh, they've said no, now they can go. You need to make sure they are informed. So you need to write all this in your body. And also for children, before I go to children, for learning disability, when they lack capacity, some learning disability do not lack capacity. If they have mild learning disability, they might have some capacity, but some might actually do not have any capacity. You have to use also following the five principles of the mental health five principle. You need to follow the best interests. So the care must be done in their best interests, but must be least restrictive that you're giving that care. And this is also to protect this patient. This patient is not engaging, is non-adherence to care, it's not concordance. You have to follow this and make sure that you follow their best interest. And if they are children, most of children do not have capacity, but when they get to 16, 17, you have to now use the Gili competency. So they can now refuse care. They are now competent to say, okay, I know, I understand, but I do not want this. Or they can say, like a girl that went to the GP and said, I want to have this pregnancy removed, and she was just 15, no, she was 16, 17. And the mom was very upset, but the GP said, went along with it. So that is your body. So you make it analytical, and so you talk about these barriers. And at the end, you talk about your conclusion. So in conclusion, you tie everything together, but always remember to end it on a positive note, that I have given them enough information. Even though they refuse care, I have given them enough information. You must always protect yourself. And at the end, you would show your reference list. One of my videos, I'll show you how to get your reference list easier for your next assignment. For each assignment, you have it stored up on your laptop. So that is the end of today's video. I hope to see you in the next video where we'll talk about more nursing teaching. Congratulations to those of you that are not in nursing. Yeah, welcome to the best field in the world. Thank you. Stay blessed. Your girlfriend, Caroline Otasanya. Bye. Stay blessed.